When I leave my apartment, everything that I see that I'm going to touch, I make sure that I Purell first. So when I leave my apartment door and I go to the elevator, it's okay that if I touch it with my hand, but then I Purell it. The second thing is you have to start psychologically working on the connection between your hands and your face. Atul Gawande, who is a Harvard-trained surgeon, I think is very famous, actually has a recommendation for people to just start wearing masks. And the idea here is not that the mask is going to prevent you from getting COVID. It's not a disease that you're most likely getting from the air. But the reason to put on a mask is because, and I do this in the hospital, is you stop touching your face. Three, you don't need a medical mask. These masks that people are wearing are not protecting them from getting the disease. And front care healthline workers need these masks right now. The fourth thing that I'll say, which is the thing that the government is talking about, is distance yourself. When you go to the pharmacy, because people are going to the pharmacy now, you don't have to wait directly in line with someone. You can stand a couple feet back. You have to shrink your social circle. Find your isolation group, your group of 3 people, 4 people, your family, and set boundaries. That is it. The people who are going to get this are people who are maintaining large social circles at this point. If you develop a fever and you are otherwise fine, if you're able, have the person in a separate room. If you're able, have the person who's sick have their own bathroom. If the person has to come out and interact with people in the family, this is a perfect indication for one medical mask. And the reason is you want to put the mask on the person who's sick. And so if in our apartment, if I was sick and I had to come out and interact with my family, before I would leave the bedroom, I would wash my hands, I would put on a mask, and then I would go out and maybe I would sit down and eat food at the table. And then after that, when I was done, I would eat the food, I would put it in the sink, I would make sure that anything I touched, which is a very simple area on the table, is just washed, and then I would go back to my room.